Datta, and I'm an MD Psychiatry. I'm a consultant neuropsychiatrist, and I'm also a de-addiction specialist. Now, today I'll be talking about something which should matter to everybody, that is substance abuse and substance dependence. In more common terminologies, this is called drug abuse or drug dependence. When we talk about drugs, it's often misconstrued that drugs are only medicines that are written. Drugs are anything which, when ingested, consumed, taken through the mode of skin, inhaled, or any other mode, cause a physiological change in our body. Our society is right now battling so much with substance abuse. In fact, throughout the world, there are cases of very young, very old people who are constantly addicted to some or the other form of addiction and some or the other form of drug. I'll be talking briefly about what addiction is, followed by some common drugs and what happens when there is withdrawal. So let's start off by understanding what is addiction. Now, addiction is commonly diagnosed by a consultant when they find some of the criteria. The top of them are 1. Tolerance. That is, every time increasingly higher amount of the drug is used. So initially, if you would do well on 30 ml of alcohol, now you probably need 120 ml, and then you need more and more and more. When there is a constant craving for the drug, so even if you're at work, you're sitting with your family, you're constantly thinking about the drug. When one consumes the drug, even knowing that it's causing harm to the person. So there are many patients who come in who have been told that their liver is damaged and they should completely quit a certain drug, yet they continue having the drug. There is also a lot of physiological dependence, which means that when the drug is suddenly stopped, or even when the quantities are reduced substantially, there may be a physiological withdrawal. We'll discuss about withdrawal a little bit briefly about each drug later. And finally, it just consumes you and affects all spheres of your life. It affects your work, it affects your family, it affects your biological functions like sleeping, eating, hygiene, and it takes a toll on your entire life. So in lay term, we say somebody is addicted when they can't think of anything but the drug. Very often we have people who deny being addicted to drug and they say, you know what, doctor, I can control it any day that I want, I can quit any day that I want. But the truth is the family is the one who says that no, it's too much, it's just going out of hand. And that's where we step in. Let's talk a little about certain specific drugs. I'll start off with alcohol. Now, alcohol is one of the most commonly consumed drug or substance. It's so widely and freely available. So whether it's rich or poor, whether it's women or men, and all parts of the world consume alcohol in some of the other form. So there's beer, whiskey. A lot of people have this myth that beer isn't alcohol. It is alcohol, and pretty much the same effects are there as any other hard liquor. There's wine, there's rum, gin, so much more. Alcohol in general is consumed socially, people say, but when I ask them how social they are, they say almost every day, and that's when it is usually an addiction. If alcohol is reduced or stopped suddenly, it may cause a certain kind of withdrawal effect. What are the symptoms of these withdrawals? To start off, they may have sweating, they may not be able to sleep at night, they may get these nightmares, they may wake up screaming, have hallucinations, that is seeing things which are not real. They may even have shaking of the entire body. And in severe cases, they can also fall into seizures, and which is almost life-threatening. Moving on to another drug, which is again there in so many people's pocket probably while they're watching this video, and that is nicotine. So there's cigarettes, there's hookah, there's e-cigarettes, there's chewing tobacco, keni, pan masala, zarda, so many more forms. Nicotine or tobacco can be consumed in so many different forms, and there are some myths that the society has about this. Some of the top myths are, people say that it helps you lose weight, that smoking helps you lose weight. This is a big myth. They say that it helps you concentrate. That's again a very big myth. It helps you fight stress. Absolutely not true. And finally, there's a very common myth thinking that hookah is safer than cigarette just because the mechanism seems to be different. But no, hookah is also dangerous. So when it comes to treating somebody with nicotine, we have to first of all see whether they're just psychologically addicted or whether they're physiologically addicted also. When nicotine is suddenly stopped, there are some common withdrawal effects that we see, some of which are irritability to begin with, weight gain, sleeplessness or insomnia. There may be some fluctuations in mood in general, there may be anxiety, depression, and so many more. Now I'd like to talk about a drug that the youngsters commonly call the herbal drug and hence consider it not even being a drug. That is cannabis. Now cannabis is consumed in so many forms. It could be bhang, it could be weed, it could be marijuana, it could be hashish, manali cream. There are just so many names. And if you say the common terms like 420 or if you say terms like a bong, Rizzler, rolling, all these just make sense to anybody who's ever tried cannabis. Cannabis is very much a drug. There are two components to it, the THC and the CBD, and one of them is highly psychoactive. Cannabis, when consumed over a period of time, can cause certain common occurrences such as amotivational syndrome, in which a person may not feel like doing anything at all. So lack of motivation to even get up from the bed, lack of motivation to even brush their teeth, lack of motivation to even, go out of the house. There is also psychosis, in which there is loss of touch with reality. So they may start hearing things which aren't true, they may start feeling things which aren't true, they may start seeing things which aren't true, so in the form of delusions and hallucinations. There's also sleeplessness or sleep disturbances, appetite disturbances, and in extreme case, it can really result in the worsening of the person's overall personality. So many youngsters who are especially in colleges who get addicted to cannabis lose out on a very promising career because of it. So yes, it is very much a drug. Finally, there are some other drugs which are commonly seen in our practices. Number one is sleeping tablets. Now, sleeping tablets are not addictive in general. However, most patients, what they do is after you prescribe them a certain amount of sleeping tablet, they just continue having it without the doctor's prescription and without the doctor's guidance, and that's when it is addictive. There is also cocaine, which is usually considered a rich person's addiction because it's pretty expensive. There is amphetamines, which are commonly abused by people either to study more or to concentrate more or to function more. There is opioids. As you know, Punjab has been grappling a lot of opioid addiction. It can also be in the form of painkillers, which are opioids. So after surgery, somebody may keep abusing a painkiller even if they don't require it. And finally, there are many other over-the-counter drugs as well. One thing which I always tell families when they come to me with a person who's addicted is that they're not doing it deliberately. Nobody wants to be addicted. The reason why addiction happens is because of a close interplay between the neurobiological, psychological, and the social makeup. So neurobiology is how we all think and the different chemicals which fire in our brain. Certain chemicals fire more when we see drugs. So in those in whom the chemical fires more, they're easily addicted. Psychological makeup, how your personality, how your coping skills with stress and all this, that also makes you either less or more inclined to being addicted. And finally, social. So whether there's a stressor, whether you are seeing somebody smoking or drinking or doing a drug very often around you, or whether the sort of circumstances that you're living in. So it's a very close interplay between all these three. Hence, we call addiction a disease. So it is a disease. Please don't blame your family members saying they're doing it on their own. They're battling a condition and a disease. So you can help them. And finally, a word of advice for those who are trying to come out of any form of addiction. Remember, you can do it. Quitting is possible for everybody. And it does take a lot of willpower. So start there. Just motivate yourself and decide that you want to quit. There are, of course, guidance in the form of meeting psychiatrists, psychologists, or even de-addiction specialists. We help motivate you. If there's a need of medication, we will prescribe, but not everybody needs medication for sure. There is also group therapy that you can enroll yourself in. So there's AA, Alcoholic Anonymous, there's NA, Narcotic Anonymous, which you can be a part of and follow the lead of those who are battling the same addiction as you. And finally, if there's anything else, you can reach out to a mental health practitioner and just speak your heart out. Thank you.